Hi everyone. Let us talk about the Eustachian tube today. This is an important question. It has been asked twice before. So let us talk about Eustachian tube. Uh, Eustachian tube is also known as the auditory tube. It is also known as the auditory tube, also called the pharyngotympanic tube. Why is it called the pharyngotympanic tube? Because it is connecting the middle ear, that is the tympanum or tympanic cavity, that is connecting the tympanic cavity with the nasopharynx. It is connecting the tympanic cavity with the nasopharynx. So it is called a pharyngo, that is a nasopharynx to the tympanic cavity or the middle ear. Okay, so that is the function. The eustachian tube is basically connecting the middle ear with the nasopharynx. So what is the direction in which it is running? It runs downwards, forwards and medially. Suppose this is the face of a patient, this is the ear of the person, and suppose this is the middle ear of the right side, this is the middle ear of the left side, and this is the nasopharynx. So the eustachian tube will be running downwards, forwards and medially. It is running downwards, it is running forwards and medially, and it is not horizontal. It is an angle of 45 degrees to the horizontal. So both the eustachian tubes will be moving downwards, forwards and medially from the middle ear to connect it to the nasopharynx. Okay, so it is an angle of 45 degrees. What is the length of this eustachian tube? The length, suppose this is a middle ear and this is the nasopharynx. The middle ear, the length of the eustachian tube is 36 millimeters. In that, this is a left sided. Okay, this is lateral, and as we are going towards the nasopharynx, this is medial. The lateral lateral one third is so suppose this is the eustachian tube, so this will be the medial part of the eustachian tube, this will be the lateral part of the eustachian tube. The lateral one third is bony because it is continuing with the tympanic cavity, which is bony, and the medial two-thirds is cartilaginous. The medial two-thirds is cartilaginous. So same thing we are trying to describe here in this diagram. This is the external auditory canal, this is the tympanic membrane, this is the malleus, this is a tensor tympanic canal for tensor tympani, from which the tensor tympani is coming and it's getting attached to the malleus. Okay, so this is the middle ear cavity, this is the tympanic end of the eustachian tube, and this is the nasopharyngeal end of the tympanic tube. So as we talked about, it is running downwards, forwards and medially. In that, the bony part, this is the bony part, this part is the bony part, the bony part is one third, and this is what we call the lateral part of the lateral one third of the eustachian tube. This one is the cartilaginous part, this one is the cartilaginous part. This cartilaginous part, because it is going medially towards the midline, so this is the medial two-third is cartilaginous. Okay, so this is the cartilaginous part and this is the medial part. This is the tympanic opening in the middle ear, this is the nasopharyngeal opening. Okay, now coming to the next slide. This cartilaginous end of the eustachian tube, where does it open? It is opening at a distance of 1.25 centimeters behind the posterior end of the inferior turbinate. Suppose this is the inferior turbinate and this is the end of the nasal cavity, and from here we are entering into the nasopharynx. So the opening of the eustachian tube is present 1.25 centimeters behind the posterior end of the inferior turbinate. Posterior end of the inferior turbinate, it is situated 1.25 centimeters behind the posterior end of the inferior turbinate. What is torus tuberous? So this is the eustachian tube. Now this is one more important part that you have to understand is this cartilaginous part of the eustachian tube is not made up of multiple cartilages. It's actually a single piece of fibroelastic cartilage. It is folded upon itself. So this is the right sided. The left sided will be like this. Okay, and the left sided will be like this. Okay, so what does it form? The entire medial lamina is formed by this fibrocartilage, and a part of the lateral lamina is also formed by this single piece of fibroelastic cartilage. The rest, the gap in between these two is filled up by a fibrous membrane. So this is what becomes the opening of the eustachian tube. This cartilaginous end of the eustachian tube will project beyond the nasopharynx. Okay, where this cartilaginous end will project beyond the nasopharynx and is covered by mucous membrane. This projection of this cartilaginous end of the eustachian tube into the mucosa, into the nasopharynx, is called the torus tuberous. This is important because this is what we are going to see when we use an endoscope, or we want to look. We can do it by a post nasal mirror also, we can see it. So it appears as a bulge. So that is where we know that, yeah, this is the eustachian tube opening will be there. One more thing is, just behind it will be what is called the fossa of Rosenmuller. That is a depression that is present behind the torus tuberous, and that is the most common place for origin of nasopharyngeal carcinoma, NPC. So here we have in the nasopharynx, we said 1.25 centimeters behind the posterior end of inferior turbinate is the opening of the eustachian tube. The bulge which is produced by the fibrocartilage is called the torus tuberous, and behind it the important structure that we have is the fossa of Rosenmuller. At the apex of this nasopharynx, sometimes you may find adenoids if it is a child. Okay, adenoids. Okay, on top of it you will have the sphenoid sinus. On top of it you will have the sella turcica, which has the pituitary gland. Okay, so that is how close it is. Okay, so where are we now? Tympanic end. The tympanic end of this eustachian tube. What is the tympan? Where does the tympanic end open? The tympanic end of the eustachian tube opens in the anterior wall of the middle ear. So we have already talked about it. In the middle ear cavity, anterior wall of the middle ear is related to the is related in its lower part to the internal carotid artery with its sympathetic plexus, and here you will have the opening of the eustachian tube, and on top of it you will have the opening of the tensor tympani, canal for tensor tympani. The canal for tensor tympani will give origin to the tensor tympani muscle, and the tendon will come out and get attached to the handle of the malleus. Okay, the tympanic end is present in the anterior wall a little above the floor. Okay, this is what we are going to try to depict it, because it is a single piece of fibroelastic cartilage which is folded upon itself. So here there is this gap. That gap is filled by a fibrous membrane. So here this is the bony part which is coming from the middle ear. Okay, this is the tympanic end of the eustachian tube. So this is the middle ear. Middle ear is entering into the, we are entering from the middle ear into the eustachian tube. The lateral 1/3, so this is the lateral part of the eustachian tube. This is the medial part of the eustachian tube. Okay, the lateral 1/3 is bony, and to that is attached to this single piece of fibroelastic cartilage which is basically folded upon itself. This is clearly shown here that it is folded upon itself to form the complete medial lamina and a part of the lateral lamina. Rest of it is closed by the fibrous membrane. One more important thing from the clinical point of view, what is the eustachian tube in children? Okay, eustachian tube in children. Eustachian tube in children, suppose this is the adult, this is the middle ear, and this is an nasopharynx, so it is coming like this. In children, the middle ear and the nasopharynx are very close to each other, and it does not have that 45-degree angle. It is almost horizontal. It is almost not totally horizontal. Little bit of angle is there, but it's almost horizontal. What we call the eustachian tube in children is wider. It is wider. It is shorter. It is shorter and more horizontal compared to adults. Because of this, what happens? Because of the angulation and because of its it is longer, the nasopharyngeal secretions cannot easily go into the tympanic cavity, into the middle ear. But because in children it is wider, shorter and horizontal, so the chances of the infection or any secretions or any milk that the baby is drinking can easily go from the nasopharynx into the middle ear. Okay, so we ask the baby as a mother of the baby to give milk to the child a little with the head and up position. We say head and up position, so that there is this natural gravity that is going to assist the food that the baby drinks, milk that the baby drinks, to go into the stomach, from the esophagus into the stomach, and does not have regurgitate. And they also, children also, you'll be seeing sometimes they'll be regurgitating milk. Okay, they does not come up. Okay, when it comes into the nasopharynx, the chance of infection going into the middle ear is common. So because of this, the acute suppurative otitis media is very common in children, very common in children. Okay, very common in children. So this can be avoided by giving milk to the baby in the head and up position. This is what we tell to the mothers. Okay, now coming to what is the situation of the eustachian tube. Eustachian tube is normally closed. All the time it is closed. Its natural position is it is closed. Only it opens during swallowing, yawning and sneezing. Otherwise it is always closed. This is something that you have to remember. This is, the eustachian tube is always closed. So this is how it is shown here. This is the medial lamina. This is the lateral lamina. This is the fibrous cartilage. This is called the Ostman's pad of fat. Here you have the tensor villi palatini muscle, which is attached to the lateral lamina. Okay, so when the tensor villi palatini contracts, it is going from this horizontal to almost from downward position to almost horizontal upward position, causing the lateral lamina to come upward, because of which you can see here the eustachian tube is getting opened. Okay, this Ostman pads of fat, and also levator villi palatini, the exact function is not known, but it is thought to also help in opening the tube only. So the tube is normally closed. By nature, it is always closed unless we swallow, unless we yawn, or unless we sneeze. The eustachian tube is closed. The opener is the tensor villi palatini. Tensor villi palatini is the main muscle causing opening of the eustachian tube opening. Okay. Now some of you could have experienced this when you are in a flight, and when you are either the flight is taking off or it is landing, then you will feel that your ears are blocked. Why does it happen? Because the eustachian tube is getting blocked. You are not able to open the eustachian tube actively, because of which what happens? The middle ear pressure becomes negative. Middle ear pressures become negative. So there will be retraction of the tympanic membrane. Tympanic membrane goes inside, and also sometimes it can be so severe that there will be collection of fluid in the middle ear. That is called serous otitis media. Sometimes there can be hemotympanum. That is, there can be blood also in the middle ear. So this can be so severe also sometimes when the eustachian tube gets closed and the middle ear pressure becomes negative. What is the function of this eustachian tube? It opens intermittently while swallowing to maintain the middle ear pressure between plus 50 and minus 50 millimeter water. So this is keeping the pressure on both sides of the tympanic membrane normal. So if this is the explanatory canal, this is the tympanic, this is the explanatory canal, this is the tympanic membrane, this is the middle ear, this is the eustachian tube. So eustachian tube function is to keep the pressure on this side and on this side of the tympanic membrane normal, so that the tympanic membrane can function at its best. If the pressure in the middle ear increases, or if the pressure in the middle ear decreases, it is not on par with the atmospheric pressure, then there will be retraction or bulging of the tympanic membrane, both of which are not useful for the proper functioning and the proper vibration of the tympanic membrane. Okay, so that is the main function of the eustachian tube. Eustachian tube is always closed except during swallowing, yawning and sneezing. Also we tell the patients, if you are having some eustachian tube problem, eustachian tube dysfunction, then you keep some chewing gum in your mouth while you are flying, in an aeroplane. So while chewing you will be swallowing, and we tell the patient not to sleep during flight. These things are precautions that the patient is asked to take if he is having eustachian tube dysfunction, and also if there is an upper respiratory tract infection also. Okay, what is the lining of the eustachian tube? Eustachian tube is lined by pseudostratified ciliated columnar epithelium. the nose, the nasopharynx, the pharynx, and even the bronchi, they are all lined by pseudostratified ciliated columnar epithelium. So this is, and also goblet cells is present. So if you see an endoscope or something, you will see that the nasal mucosa is always wet. It is always having a covering of the mucosa, and these cilia will beat towards, in the case of a Eustachian tube, they will beat towards the nasopharyngeal opening. So the cilia will be towards the nasopharyngeal opening into the nasopharynx, so that the mucus is produced, and also mucus is removed from the tympanic cavity and the Eustachian tube into the nasopharynx. Okay, doesn't cause blocking of the Eustachian tube. What is the nerve supply? Nerve supply, the tympanic plexus. Okay, we know that. So we know that the entire tympanic cavity is supplied by the tympanic plexus. So what is the tympanic plexus? The tympanic plexus is formed by the sympathetic plexus from around the internal carotid artery plus the glossopharyngeal tympanic branch of the glossopharyngeal nerve unite together to form the tympanic plexus, and it provides sensory innervation to whole of the middle ear. Whole of the middle ear means what? The middle ear cavity proper, the attic, the hypotympanum, the adductus ad antrum, the mastoid hair cells, and the Eustachian tube. All this is supplied by the tympanic plexus. Okay, and what is the muscle that is supplying the tensor villi palatini? It is the mandibular branch of the trigeminal nerve. The trigeminal nerve's mandibular branch is supplying the tensor villi palatini, which is responsible for opening of the Eustachian tube. Okay, what is the functions of the Eustachian tube? We have already, once we understand what is its position and what its function, we will know what is its function for. The first function is to provide ventilation and regulation of middle ear pressure. For normal hearing, pressure on both sides of the tympanic membrane should be equal. Yeah, we have talked about that. And if the Eustachian tube gets blocked, either because of upper respiratory tract infection, or because of the natural dysfunction of the Eustachian tube, or because of negative pressure outside, as in an aircraft, it can cause negative pressure, and this negative pressure will prevent you from having a normal hearing. So the Eustachian tube's function is to keep the pressure on both sides of the tympanic membrane, normal. Okay, this is the tympanic membrane. It is providing ventilation and equalization of the pressure on both sides of the tympanic membrane. So this is the first and the main function of the Eustachian tube. Second one. Now when we are speaking also, the sound of what we speak can enter into the middle ear, and it can affect or prevent us from hearing the outside sound clearly. To prevent that also, Eustachian tube is closed, and it prevents nasopharyngeal sound pressure. The sound that we produce with our vocal cords, that sound also can affect our hearing, and this Eustachian tube, because it is almost always closed, will prevent our own sound from affecting what we want to hear. Second one is protection against the nasopharyngeal secretions. Okay, we have already talked about that. Sometimes, patients can present to you and say, I had this upper respiratory tract infection and I was forcefully blowing my nose, and you can see that sometimes the tympanic membrane, and I cannot hear properly, and I'm having severe ear pain, and it started after I forcefully blew my nose. So that pressure was transmitted through the Eustachian tube into the middle ear. You can sometimes see that the tympanic membrane is congested. It can be because of upper respiratory tract infection becoming ASOM, and also it can be because of trauma, because of forceful nose blowing. Sometimes, rare cases, have also seen that the tympanic membrane can rupture also. There can be perforation of the tympanic membrane also when the patient forcefully blows his nose. Okay, so this can also happen. Okay, so it is protection against your own voice, that is nasopharyngeal sound pressure. It is preventing a reflux of nasopharyngeal secretions from the nasopharynx into the middle ear, as in upper respiratory tract infection. And sometimes high pressure, so we advise the patient not to forcefully blow the nose. You can close one nostril and blow the other nostril, and close the other nostril and blow the first one. So that's how you can clear any nasal secretions if you want to. But forceful nose blowing is to be avoided. What is the third one? Middle ear clearance of secretions. Okay, this is understood. The entire the eustachian tube is lined by ciliated columnar epithelium. The cilia beat outwards towards the nasopharynx, thus helping in clearing the secretions and debris from the middle ear into the nasopharynx. So what is the first function? Ventilation and regulation of middle ear pressure. Second one is protection against the nasopharyngeal sound pressure and reflux of nasopharyngeal secretion. And third one is middle ear clearance of secretion. So these are the functions of the eustachian tube. Coming to this last slide, I included this slide because this was important from the NEET PG point of view, and also this is sometimes confusing. They try to compare between the external auditory canal and the eustachian tube. So here you can see this, we are passing laterally to medially. So this is the right side of the patient. So this is the external auditory canal. The lateral 1/3 of the eustachian of the external auditory canal, which is continuous with the pinna, is cartilaginous. So lateral 1/3 is cartilaginous and it is 8 millimeters. The medial 2/3 is bony. It is 16 millimeters. This entire length of the external auditory canal is 24 millimeters. Okay. So the lateral 1/3, which is in continuation with the pinna, is cartilaginous, and the medial 2/3, which is in continuation with the tympanic cavity, is bony. So external auditory canal, lateral 1/3 is cartilaginous and the size is 8 millimeters, and the medial 2/3 is bony. Its size is 16 millimeters, and the total length of the external auditory canal is 24 millimeters. Now to compare it with the eustachian tube, the lateral 1/3, which is in continuation with the tympanic cavity or the middle ear, is bony. Because this tympanic cavity middle ear is bony, so the whatever is in continuation with it is bony. Okay, so lateral 1/3 is bony. So this is the medial 2/3. Medial 2/3 is cartilaginous. Entire length, what did we say? It is 36 millimeters. 36 millimeters, and the bony part is 12 millimeters, and the cartilaginous part is 24 millimeters. So this is what is said here. If you have a doubt anytime, what is bony, which one is bony, which one is cartilaginous, just draw the middle ear. From the middle ear you have the external auditory canal. What is connected to the external auditory canal? The first one, the medial part of the external auditory canal, it will be bony. And if you draw this one also here, the eustachian tube, what is connected to the middle ear, that is the medial 1/3, the lateral 1/3 of the, this is the lateral 1/3 of the eustachian tube. This is the medial 2/3 of the eustachian tube. So this is 2/3, it is bony. This is 1/3, it is cartilaginous. So bony part, the external auditory canal, 2/3 is bony. 2/3 is bony. 1/3 is cartilaginous. 1/3 is cartilaginous. Eustachian tube, 1/3 is bony. Eustachian tube, 1/3 is bony. 2/3 part is cartilaginous. 2/3 part is cartilaginous. Okay. Lateral 1/3 of external auditory canal. Lateral 1/3 of external auditory canal is this one. It is cartilaginous in continuation with the cartilaginous pinna. Lateral 1/3 is bony in continuation with the bony middle ear. This is the bony middle ear. This is continuation with this. So the lateral 1/3 is bony. So both the lateral 1/3s are lateral 1/3. Okay. The medial 2/3, medial 2/3. Okay. The total length of the external auditory canal is 24 millimeters. External auditory canal. Total length of eustachian tube is 36 millimeters. So eustachian tube is longer compared to the external auditory canal. Cartilaginous part is 8 millimeters. Bony part is 16 millimeters. Here this is the opposite. Bony part is smaller here. Bony part is 12 millimeters. Here the bony part is 16, 2/3. Okay. Bony part is 1/3 bony, and 2/3 the medial 2/3 is cartilaginous. Isthmus. Both of them have an isthmus, but what is the isthmus? External, this is the pinna, this is the external auditory canal, this is the tympanic membrane. Just 6 millimeters lateral to the tympanic membrane, there is a bulge of the external auditory canal, which is called the isthmus. This isthmus is not the same as this isthmus. Isthmus of the eustachian tube is the narrowest part. Yeah, isthmus here also is the narrowest part, but it is at the junction of the bony and cartilaginous part. This part, bony and the cartilaginous part, you have the isthmus, which is the narrowest part. But here, this is just the bony part. There is a bulge, which is 6 millimeters lateral to the tympanic membrane, which is the narrowest part. What is the importance here? Suppose a foreign body gets lodged medial to this isthmus, then it is difficult to remove this. So isthmus, important clinical point from the clinical point of view. Foreign bodies lodged medial to the isthmus are difficult to remove. Isthmus, in the case of eustachian tube, is the narrowest part which is present at the junction of the bony and cartilaginous parts. Okay, I hope I have made these things clear. This one is always going to be confusing for you. So whenever they ask you, how to, if they ask you to compare, just draw a diagram of the middle ear and you connect it to the external auditory canal, and then you connect the middle ear to the eustachian tube. Eustachian tube is longer. So you say this one is 24 millimeters, you say this one is 36 millimeters. Because this is bony, so the continuation of the external auditory canal here will be bony, the continuation of the eustachian tube here will be bony. So the lateral one third is cartilaginous, the medial 2/3 is bony. Here the lateral 1/3 is bony and the medial 2/3 is cartilaginous. Like this you can remember this. Right. Thank you so much for the patient listening. Meet you in the next topic.